Hey y'all, so today's lesson will be on hypertension. Alright, so what is the pathophysiology behind hypertension? So hypertension is when the force against the artery wall is too high. Alright, so think about your blood vessel as a water hose. So when water flows through the hose at a normal rate, everything works smoothly, right? However, if you turn the water up too high, the pressure increases. This can cause the hose to wear out, leak, or even burst over time. In this analogy, hypertension is like turning up the water pressure too high. The heart is the pump that pushes the blood through the arteries, right? So if the pressure is too high for a long time, it can damage the arteries just like a water hose can get damaged or worn out. Does that make sense? I hope that little analogy made sense. But you have systolic and you have diastolic. So what happens during systolic? During the systolic, which is your top number, right? The systolic is the amount of pressure in the arteries when the heart contracts. And diastolic is when the amount of pressure in the arteries when the heart relaxes after contracting. So systolic, contraction, diastolic, relaxing. Alright, so here are the stages of hypertension. So pre-hypertension starts with a systolic of 120 to 139. So what is our normal blood pressure? So our normal blood pressure should be 120 systolic or less, and our diastolic should be 80 or less. All right, so stage 1, you see the number. Stage 2, you see your number. So remember, when you're thinking about staging your blood pressures, it's either or. It doesn't have to be both. So let's say if a patient's blood pressure was 142 over 80, that patient still has stage 1 hypertension, even though their diastolic is normal. Does that make sense? All right, so secondary hypertension, this is a blood pressure that is caused by an underlying condition or factor. So this patient's blood pressure is going to be high because of something else, right? So if the patient have cardiovascular disorders, that could cause their blood pressure to be high. This would be considered secondary. If they had renal disorders, if they have endocrine disorders, even pregnancy, it's the reason why their blood pressure could be high. That's secondary. Or even let's say you're taking a medication and your blood pressure is high because you're on this medication. This is secondary hypertension. So remember, secondary hypertension, it is related to something else. It is related to another disorder. All right, so what are some complications of hypertension, of uncontrolled hypertension? Is heart failure. So what happens with heart failure? So the heart has to work harder to pump blood against the increased pressure, which can weaken the heart muscle over time, leading to heart failure. Stroke. Hypertension increases the risk of stroke caused by blood clots, whether it's an ischemic stroke or whether it's a hemorrhagic stroke caused by bleeding in the brain. So it increases the risk for both types of strokes by damaging the blood vessels and increasing the likelihood of blockages. All right, kidney damage. So kidney damage, this is caused by high blood pressure can damage the blood vessels in the kidneys, impairing their ability to filter the waste from the blood, and this can lead to chronic kidney disease or even kidney failure. So vision loss. If your patient has uncontrolled high blood pressure for some time, this can cause damage to the blood vessels in your retina, right? So this can lead to vision loss or blindness. And then the last one is aneurysm. So high blood pressure can weaken the blood vessels and put the patient at risk for aneurysm, which is just basically bulging or stretching of your blood vessels. And these can rupture, and that's life-threatening. So you guys, it is so important, especially for newly diagnosed patients, to know the severity of high blood pressure. Knowing that if you don't change your eating habits, and if you don't take your medication, these are some serious things that you could be facing. All right, so what are some signs and symptoms of hypertension? The biggest thing is they call it the silent killer because it is asymptomatic. A patient can have high blood pressure for years and not know until one of the complications happen, until they have a stroke, and then they realize that you've had high blood pressure for years. So the biggest thing is to know that high blood pressure can be asymptomatic, but if they are symptomatic, they will complain of a headache, they will have visual disturbances, they could have dizziness, they could complain of chest pain, the patient could complain of tinnitus, which is ringing in the ears, and this is caused by that high blood pressure can affect the blood flow to the structures of the inner ear, and this can alter the blood flow, which can lead to changes in your auditory system. So the patient may hear buzzing or ringing in their ears. Also, the patient could have nosebleeds because of that increased pressure, that it can rupture blood vessels in your nose. So what are you going to do for hypertension? So we're going to give our patient antihypertensive medications as ordered. So just make sure that you go over your pharmacology to know common medications that we give. So your ACE inhibitors, your ARBs, your diuretics, and medications like that. So one thing is we want to make sure that we are measuring the blood pressure accurately, that we are using the right size cuff on the patient, that they don't have their legs crossed, that the patient is relaxed, and that if you get a high reading, you want to at least check the blood pressure twice and check it on different arms. And I also challenge you to get a manual if the patient's blood pressure is high. Get a manual to confirm your reading. Also, know when to call the doctor. So I always say trend your patient's vital signs. So trend your patient vital signs, meaning keep a track of it. So like go back and look at what were they in the last 24 hours. And sometimes you may be able to see a steady increase. So you want to always trend your vital signs, and you want to know when to call the doctor. So you should have orders, provider orders to tell you, hey, this is when you need to reach out to the doctor. But if you don't have orders, you want to use your nursing judgment to know, like, wait, the doctor needs to know about this change. And the biggest thing is education. It's prevention, especially if your patient has essential hypertension, meaning there's no really cause behind it. There is a lot of things that they can modify, such as their diet, such as their exercise, such as smoking, such as drinking, that they can, get rid of, and that could lower their blood pressure, that they wouldn't even need any medication. So you definitely want to educate your patient on prevention. All right, so this NCLEX question reads, a nurse is discussing with a nursing student how to accurately measure blood pressure. Which of the following points does the nurse emphasize? A, the size of the cuff does not matter as long as it fits snugly around the arm. B, a cuff that is too small will give false blood pressure, a false low blood pressure reading. C, a cuff that is too large will give a false high blood pressure reading. Or D, a cuff that is too small will give a false high blood pressure reading. So if you chose using a cuff that is too small will give a high blood pressure measurement, that is correct. While using a cuff that is too large results into a false low measurement. So it is so important that you get the correct fitting cuff. So the answer was D, okay? All right, so let's go into hypertensive crisis. So what is hypertensive crisis? This is when the blood pressure is 180/20 and they have signs of organ damage. So what are we going to do? So we want to make sure that we notify the physician ASAP, as soon as possible. We want to maintain a patent airway if they are complaining of any type of respiratory symptoms. We want to administer IV medications as ordered, and we want to continuously monitor this patient's blood pressure. So this patient needs to be on bed rest with the head of the bed at 45 degrees. So the rationale behind that is that it reduces the cardiac workload. It decreases the venous return to the heart, which is in result lowers the workload of the heart. So the biggest thing that we're going to be doing for this patient is administering antihypertensive medications to get their blood pressure down. All right, so this NCLEX question reads, a patient is admitted to the ICU with a diagnosis of hypertensive emergency or crisis. The patient's blood pressure is 200/130. The nurse is preparing to administer IV nitropress. Upon assessment, which of the following patient findings require immediate intervention by the nurse? A, nausea and severe headache. B, chest pain 3 out of 10. C, urine output of 40 cc's an hour. Or D, left arm numbness and weakness. All right, so if you chose D, you are correct. So the finding of left arm numbness and weakness may indicate that the patient is experiencing neurological symptoms associated with a stroke. So remember that a patient in hypertensive emergency, that they will have that high blood pressure and organ damage signs and symptoms. So with C, the urine output of 40 cc's, that is within normal limits. So nausea and a severe headache, those are important, but they're not priority. Chest pain 3 out of 10, that is important, but not as important as that patient having left arm numbness and weakness. All right, let's try another one. It says a 77-year-old woman presents to the local community center for a blood pressure screening. The woman's blood pressure is reading 180/90. The woman has a history of hypertension, but currently is not taking her medication. Which of the following questions is most appropriate for the nurse to ask the patient first? A, are you having trouble paying for your medication? B, what medications are you prescribed? C, are you able to get to the pharmacy to pick up your medications? Or D, why are you not taking your medications? All right, so if you chose D, this is correct. So it is important for the nurse to first find out the reason why the patient is not taking their medications. So remember, adhering to your therapeutic program may be difficult for older adults. The medication regimen can be difficult to remember, and the expense can be challenging. They may be on multiple medications, but you just don't want to assume, because the other option A says that, are you having trouble paying for your medications? Don't assume. Don't assume. What medications are you prescribed? Well, we can ask that next. But are you able to get to the pharmacy to pick up? We want to ask the patient just straight up, why are you not taking your medication?